Why are the Arcuate field defects produced in the early stages of glaucoma? Why are the Arcuate field defects important in primary open-angle glaucoma? The Arcuate field defects are important because they are being produced in the early stages of glaucoma. Before we discuss why the Arcuate field defects are produced in the early stages of glaucoma, it is imperative to discuss the arrangement of the arcuate nerve fibers in the retina. What are the arcuate nerve fibers in the retina? The superior and inferior arcuate nerve fibers originate from the temporal raphe. They have to arch above and below the papillomacular bundle in order to enter the superior and inferior poles of the optic disc, respectively. Thus, these temporal nerve fibers acquire a characteristic double arcuate shape. As you can see in the schematic diagram below in the green fibers, you can see the superior and inferior arcuate nerve fibers. The arcuate nerve fibers lie in the 10 to 20 degrees of the pericentral area from the central fixation point. They also lie in layers from superficial or closer to the vitreous to deep or closer to the sclera, similar to the rest of the retinal nerve fibers. The most superficial nerve fibers originate closest to the optic disc and exit from the most central part of the disc, whereas the most deepest nerve fibers originate from the most distant part of the retina and exits the scleral opening closest to the scleral edge. As you can see in the schematic diagram below, in which layer 1 is the superficial fibers closer to the vitreous, and layer 5 being the deep fibers closer to the sclera. Why are the arcuate fibers being destroyed early in glaucoma? There are two main theories about the early loss of arcuate nerve fibers in glaucoma. The first one is a mechanical theory, in which it is theorized that the upper and lower poles of the lamina cribrosa have larger sized pores. Therefore, the nerve fibers are easily compressed by the distortion of the laminar beams, induced by elevated intraocular pressure. This in turn causes impediment of the axoplasmic flow, resulting in death of the retinal ganglion cells. However, the above theory becomes invalid because the arcuate pattern of nerve fibers, after they make their 90-degree turn, disappears in the lamina cribrosa. Therefore, any injury to the nerve fibers in the lamina cribrosa wouldn't produce the arcuate field defects, or in other words, the lamina cribrosa couldn't be the site of injury in glaucoma. The second theory is the sensitivity theory, in which the arcuate nerve fibers are the most sensitive to elevated intraocular pressure, and therefore it is theorized that they are being destroyed early in glaucoma for that reason. However, if the arcuate nerve fibers were unduly sensitive to elevated intraocular pressure, then the entire arcuate nerve fiber bundle should have been destroyed at once. But in actuality, the arcuate fibers are being destroyed gradually over the years in glaucoma. Furthermore, the margins of the arcuate field defects are sharply defined as though they have been selectively cut out with a pair of scissors. As you can see in the schematic diagram of a right eye arcuate field defect with sharply defined margins. Only a mechanical process can lead to the production of the arcuate field defects. Only a mechanical process can lead to the precise, selective destruction of the arcuate nerve fibers. Then, what may be that mechanical process? Elevated IOP may be compressing the delicate circulation of the border tissue of Elschnig, resulting in chronic ischemia and its degeneration. Due to degeneration of the border tissue, the lamina cribrosa would begin sinking in the scleral canal, thereby creating a mechanical process. As the lamina cribrosa begins to sink, the nerve fibers would be stretched and severed at the scleral edge. This process would start with the deepest peripheral nerve fibers being situated closest to the scleral edge and ending with the superficial macular fibers in an orderly sequence. As you can see in the schematic diagram below, the sinking of the lamina cribrosa, shown in black, resulting in the orderly exotomy of retinal nerve fibers at the scleral edge. Arcuate field defects are produced early in glaucoma because they are fewest in number. The entire 360 degrees of the peripheral, pericentral, and macular nerve fibers are being severed simultaneously from day one, starting with their deepest fibers. As to when severance of the retinal nerve fibers would produce visual field defects would depend upon the number of retinal nerve fibers present at any particular location. For example, severance of the arcuate fibers, being fewest in number and characteristic in shape, would produce minute scotomas in the pericentral area in the early stages of glaucoma due to their early depletion. As glaucoma progresses and more of the arcuate nerve fibers are severed, these minute scotomas become larger and coalesce to form full arcuate scotomas after the depletion of the entire arcuate fibers. This would produce the well-defined arcuate field defects in glaucoma. Why the macular fibers last until the end stage of glaucoma? It would be the number of retinal fibers present at a particular location which would determine the time for the production of their field defects. For example, the arcuate fibers, being fewest in number, would be depleted earlier, while the macular fibers, being abundant, would last until the end stage. The timing of the production of visual field effects is more of a numbers game and not due to their varying degree of sensitivity to elevated intraocular pressure. However, elevated intraocular pressure by its direct action couldn't lead to the orderly loss of nerve fibers. Therefore, it would be irrelevant as to whether some retinal nerve fibers are more sensitive or more resistant to increased IOP in glaucoma. Please like and subscribe so that I can share more of my content of my views in glaucoma. Thank you.